Well, TLX is a good combination between a BLX and old regular tissue level implant. So it tries to combine the best of each of the two implants. Well, first of all, I think it's a good implant. It's easy to use. And as I mentioned before, it tries to combine the benefit of tissue level, which is excellent, to create a soft tissue seal around the color of the implant. But it's also friendly because it's easier to place it compared to a regular tissue level implant. There are several papers that confirm the fact that the long-term survival rate with tissue level implants are higher. In the last ITI treatment guide, it's well written that osseointegration is easy and simple, soft tissue integration is difficult, long-term maintenance is complicated, which means that dentists should pay attention, much more attention, to the soft tissue around the color of the implant. This is the area where all complications start from. So it's very important that in the future, more and more dentists will pay attention to the soft tissue around the color of the implant.